So I am Dr. Sudhir from Chennai, and I'm going to present my paper on does endoscope have a better scope in sexual function as well. We all know that sexual function is one of the most important determinants of quality of life, and more than two-thirds of patients with low back pain have sexual dysfunction. The disease itself, or the surgical approach, or the neurological function and pain can affect it after spine surgeries. Despite the high prevalence of sexual function, counseling is seldom done as a part of our care, and all the studies, they seldom assess sexual function as part of the primary outcome. And this results in inability of the surgeons to set expectations about the postoperative sexual function in all these patients, like the frequency of sexual intercourse, when they should start, and how they should perform after surgery. So with this background, we aimed to compare the sexual function between microdiscectomy and endoscopic discectomy patients and to evaluate the factors influencing sexual outcomes. So this is a prospective study done in 63 patients with 34 males and 29 females with an average age of 37.5 years with single level disc prolapse. 33 patients underwent microdiscectomy, rest of the patients underwent transforaminal discectomy and interlaminar endoscopic discectomy. The sexual outcome was analyzed using the MSFI for males and FSFI for females, and the patients were asked to fill out these questionnaires preoperatively and at the end of 4 weeks, 3 months and 6 months. Additional data like resuming intercourse after spine surgery. This is the score used for males with 11 points on 5 domains, and this is the females score used for females, which consists of 6 domains and various questionnaires under that. Coming to the results, we found that there was a significant improvement in the sexual function in all the endoscopic discectomy patients at the 4 weeks and 6 months postoperative period, whereas in microdiscectomy patients, initially there was a decline at the end of 4 weeks postoperatively, but however, all the patients improved significantly at the end of 3 months and 6 months postoperatively. And when we compared the transforaminal and interlaminar groups, we found that there was a significant improvement in the sexual function in all the patients at the end of 4 weeks and 4 months, 6 months after the surgery in both the groups. Regarding resumption of sexual activity after surgery, we found that 70% of the patients resumed their sexual activities in the endoscopic group within 4 weeks, whereas only 50% of the patients were able to resume their sexual activities in the microdiscectomy group at the end of 4 weeks. However, all the 100% of the patients resumed their sexual activities within 3 months. This is an article by Akbar et al. Who stated that 18% of the patients had decreased sexual desire and 18% had premature ejaculation in males, whereas 47% had decreased sexual desire in female patients who had disc prolapse. And post-operatively, the first attempted sexual intercourse in their study was around 27 days after surgery, and the frequency of sexual intercourse increased while any type of sexual problem had decreased in all the patients. This is a systematic review which stated that there is very limited evidence from high quality articles regarding the sexual activity after spine surgery, and all the studies stated improvement of sexual activity and function after spine surgery. However, future studies incorporating specific assessment is required to determine this quality of life. So our study is the first study to analyze the sexual function of endoscopic discectomy, and it is also the first time in the world literature to compare sexual function between microdiscectomy and endoscopic discectomy. To conclude, sexual outcome is an integral part of the treatment. Mild reduction is seen in the sexual function in microdiscectomy group at the end of 4 weeks. However, they improved at the end of 3 months. No difference is seen at the end of 3 months when we compare both the groups, and all the patients can start intercourse as early as possible after the surgery. Nandri.